And we want to welcome you all to our VoCall webinar. We, as you noticed, we're App of the Month for Allscripts this month in April, and we were excited to be sharing with you this new and innovative voice app that greatly improves productivity in your practice and increases patient engagement overall. So a little housekeeping today. Presentation will be about 30 minutes long, and we'll have a Q&A session at the end. There is a Q&A button at the bottom of your screen. You can click that and ask questions along the way at any time. We'll save all the questions to the end, so we're not ignoring you. Enter the question, we'll get to it at the end, and we'll answer questions as they've come in and get them back to you. This presentation is being recorded and will be sent out to you. And we find that it's best viewed in speaker view, and speaker view would be up in your upper right-hand corner. Yeah, everyone is muted. I do see the chat. You guys, everyone is muted, so you don't have to worry about staying quiet. So you will be muted. So introductions, I'm going to run through real quick. My name is Bill Morrow, and along with being a client success manager here at VoCall, I'm also going to be your moderator today. Joining me is my counterpart, AJ Joshi, as well. He's on the client success team, and we'll kick things off with an overview of the VoCall solution. We'll then jump over to Paul Cox, CEO of VoCall, for some insights into why he developed VoCall. And then from there, we'll jump over and speak to Dr. Jim Geyer and Monica Henderson of Alabama Neurology and Sleep Medicine. They're going to give us some feedback on how they use VoCall and how it's impacted their practice. And then Paul, Dr. Geyer, Monica will all be available at the end for questions as well. And with that, I'm going to kick it over to AJ.
Thanks, Bill. And thanks everyone for joining. So before we dive in, let's state the obvious. Scheduling is a major problem for practices everywhere. And just the sheer number of scheduling calls that practices get, we have heard hundreds of such calls per day. They just burn out and overwhelm schedulers. And what about the time when the scheduler calls in sick, maybe due to COVID, or just decides not to show up or quits? These are major problems that impact patients. Patients, when they try to schedule appointments, often, many of us have personal experiences with this, have to lead with long hold times, or sometimes have to leave phone messages and play phone tag, and to the point of frustration so much that sometimes they just resort to no-shows. And no-shows cost practices a lot of money. One study we found shows that an average family practice loses over $150,000 per year per provider, just based on unfilled appointments on the calendars. So you ask, what are these scheduling calls? So our own assessment of scheduling calls at practices shows that 60% of these calls are to do routine and mundane tasks, such as rescheduling appointments, canceling and confirm. Patients are spending, what they want is ease of doing these simple tasks. Now, while online scheduling tools and apps are increasingly popular in the world today, medical practices remain different. So what we find is especially elderly patients are less likely to want to share their personal information online, or even have to download an app and learn a new system to do these routine tasks. In fact, we find that 65% of all patients prefer just picking up the phone and calling like they've always done. So VoCall addresses this very issue by meeting patients where they are. Our solution has a voice assistant named Amy, who speaks to patients when they call and helps them address their rescheduling, confirming, and canceling needs. So when I say voice assistant, think of Amy as you would Alexa or Siri. These are ones that you might be more familiar with. So the beauty of this is patient calls the same number that they normally call, but they get diverted to VoCall, to Amy, through an existing phone tree. It's a certified integration with practice management, exclusive for Allscripts users. So One of the key highlights is this is an innovative application, doesn't use any text-based tool, and it's available 24/7. So patients can, on a Saturday night, call and reschedule their appointments. So we find that, and we've done studies on this to see how long these take. Every rescheduling call takes between 4 to 6 minutes to execute, both from just the sheer number of steps that the schedulers have to go through multiple screens to get that, but also the patients also having some dialogue back and forth. And take that 4 to 6 minutes, and based on what I just told you before, hundreds of such calls in a day, that adds up to a lot of time that can be given back to the practice. And that giving back to that practice, that's time that could be spent doing things like greeting patients when they walk in the door for front desk staff, or focusing on more revenue generating activities like looking at billing or insurance reimbursements. We find that VoCall frees up one person for a typical 8-provider practice. So because of the ease of doing this, patients are more likely to reschedule their appointments, and hence the number of unfilled appointments is really reduced. And so that reduces the number of no-shows. Our solution is simple, intuitive, and it's patient-focused. So patients want to talk to someone, and we have a solution that allows them to do that. And it takes away their need of having to wait on hold and leave voicemails to do these simple tasks. So I'll turn it back over to you, Bill.
Thanks, AJ. Great oversight and overview. Let me welcome Paul Cox to the discussion. For those of you who don't know Paul is background includes founding multiple successful healthcare companies, and he was previously the head of software development and architecture for the surgical technology sector of Medtronic, where he led the product development efforts for over $700 million of annual revenues. That's a lot to say, Paul. So thanks for joining us today.
Yeah, glad to be here. Thanks, Bill.
So what drove you to create VoCall, Paul?
Well, so I spent most of my career in developing healthcare technology. And with past years while I was with Medtronic and other businesses, I started to realize in talking with physicians and other healthcare providers around the country that the scheduling was just a huge problem. I mean, everybody had to deal with it. And everybody said it was a problem. And so in recent years, the Amazon Alexa and Google Home and Siri, the technology was really maturing. And there were a lot of people using these smart speakers at home. And so it occurred to me that, here's a problem of scheduling. Here's this technology that's really emerging and becoming accepted. And so between these two, I knew there was a solution that had to be done. So that was the reason I started Magic Medical.
Awesome. Why scheduling? You mentioned there's a lot of areas, there's a lot of things that you could have tackled, but why was scheduling so important? Why did you think it needed to be addressed?
It was at the top of the list of most of the physicians and healthcare providers I talked to. And then coupled with that was that the voice technology was just a real good match for solving that problem.
So what were the key components that you took into consideration when you were developing VoCall?
Well, one of the, I guess, two big things that I learned through my healthcare experience people want two things when they have a new product. One, they want it to be easy to set up when they get it in the hospital, and they want it to be easy to use. And so I always go back to what Steve Jobs with the iPhone, that, the reason people love that so much was because it was just so easy to use. They did a tremendous job of just making the whole user experience. And so that's what we try to do with VoCall, to make it easy to set up and easy to use.
Excellent. And what does it take to set up VoCall, Paul? What is the process?
It's really a very straightforward process. When someone signs up, we assign them a client manager that walks them through the steps of what they need to do. And basically, the new client will just go to the web portal and sign in and enter their clinic information along with their Allscripts information. And then once they do that, they will be assigned a phone number to their practice, and they can integrate that phone number into their own phone tree, or just have that as a standalone number that people can call in to manage their scheduling.
Excellent. Thanks, Paul. Good insight. So let's jump over to Dr. Jim Geyer and Monica Henderson of Alabama Neurology and Sleep Medicine. Dr. Geyer is the medical director for practice and oversees 3 sleep centers with a total staff of 34. Monica is the administrative director and patient education coordinator for all 3 of these centers, and they are currently using VoCall. Thanks for joining today.
Thank you.
Dr. Geyer, what were your thoughts when you were approached by Paul and the VoCall team about the VoCall solution?
Well, scheduling is a problem all the time, and the more you think about it, the more clear it becomes that scheduling is really intertwined with everything we do. It's not just scheduling that one appointment. There's a entire list of things that are associated with it. And so I thought it was an excellent addition to the practice that really got to the heart of what drives not the clinical care per se, but the clinical flow.
Yeah. And Monica, about how many scheduling calls does your practice take in a typical day?
We have 4 to 5 schedulers, and in a typical day, about 250 phone calls a day to just those scheduling lines.
Wow.
250 to 300.
Wow. Yeah, it's a lot of calls. And as AJ said, 4 to 6 minutes a piece on scheduling or rescheduling and doing that work. So Dr. Geyer, how has your experience been with VoCall now that you have it installed and you've been using it for a little while now?
Well, like with anything you use, it takes some adjusting your system to, but it's really worked out remarkably. The people who've joined us who live in the South know that a snow day in Alabama is, even if they're just flurries, everything shuts down.
Yeah.
And when we first started with the system, one of our very first days was a day that we had at least some flurries. So we had to close the practice for the day. The roads were closed. And we were able to send out a message to patients to just please call the scheduling line. Amy was able to field the majority of the calls. There were a couple of sort of specialty questions, and it diverted those out of the system to a live scheduler, but it was able to handle the majority of just the simple, I know clinic was canceled and I'd like to swap to a different day.
Excellent. Excellent. So Amy was able to help you out so you didn't see the rush of people calling the next day or the voicemail, I guess, huh?
That's right. It's really an avalanche of things that happen. You get patients call back, they may get shunted to voicemail, they leave a voicemail, there's phone tag. As a physician, I really didn't understand all these problems went on until we started trying to enhance the efficiency of the practice. And the more questions I asked, the more apparent it became that the system is extremely complex and also has to this point really been neglected by technology.
Yeah, good point. Monica, how's VoCall worked for you? What have you seen on your side?
From the scheduler side of you, they're ecstatic about it. Example, the snow day he was referring to, that next day, they would have spent the entire day plus some trying to get in touch with those particular patients and get them rescheduled. Missed hours upon hours of it. So that was great for them there. But on a regular day, it's actually allowing them not to be, I guess, honestly, they're not as stressed because they know that they're going to have, more time to handle and complete the task that their boss, their doctor, or whoever wants them to handle, as opposed to not being able to take care of that stuff. A lot of things in scheduling, especially at our practice, we refer people to other specialty physicians and things of that sort. And those are time-consuming things. And some of the schedulers are the ones that handle those duties. And they're not able to get all that done due to the phone ringing all day long and due to the hours of getting voicemails and leaving voicemails and, like he said, playing phone tag. So they have been ecstatic to have the ability to step back and complete those tasks, because then those people are not calling them saying, have you completed this for me yet? So, it's just the quicker you can take care of it, the quicker then you don't have the extra calls. So it's worked out great for them.
No, that's awesome. So, Dr. Geyer, what's the patient feedback been like talking to Amy?
It's been good. There's my favorite interaction is when we were first starting out working on it. I had my then 89-year-old, now 90-year-old mother-in-law who doesn't own a cell phone and does not own a computer call in and reschedule an appointment. And she found it to be easy to do. And I was actually shocked. She said it was easy and just described it as a nice process. So my thought is, if she can be happy, a lot of people are going to find it pretty easy. And in general, patients have had a very positive comment on it. In general, they like being able to call and just confirm an appointment quickly and not sit on hold or waiting for somebody to call them back just to confirm their appointments at 3 o'clock instead of 2 o'clock.
Yeah. Well, I think that's high praise from your mother-in-law. So maybe we should add that as a testimonial, because I don't think it'll get any better than that. So what has been the overall impact on the practice?
Well, one of the things that we've been able to do is, as we've sort of moved into the process of using it and understanding what it can provide, we're looking to transition one of our schedulers away from scheduling and into a more direct patient care role. It's a value-added service for the practice. We've got the opportunity to go from spending time on the phone, serving an important function, but one that we can take over and slide this person into a patient care role that benefits the practice monetarily and benefits the care of the patient.
Excellent. And Monica, what have you seen the impact be?
Well, as he just mentioned, also, it allowed that employee to have an advancement and to do something different, so that there's not as much, let's say, burnout. I think we all have burnout at certain times, but it has allowed a lot of the schedulers to be able to be involved in other areas of the office, and it's helped them have a little bit better positive outlook every day, because it's not the exact same thing every day. I think we all need change sometimes. So that's been very beneficial from just an employee standpoint for them to be able to do that.
Well, great insight from both of you guys, Dr. Geyer and Monica. Appreciate the insight and very helpful. So I'm going to kick it back over to AJ and let him give a demo of VoCall. You're still on mute, AJ.
That's the phrase of 2020 and 2021. So thanks, Bill. I'll walk you all through a demo of Amy. And this is me calling into a live clinic environment.
Welcome to appointment scheduling. I'm here to help you manage your existing appointments. First, I will need to ask you for some information. Can you give me your telephone number, starting with your area code?
Yes, it's 205-555-0122.
Now I need to confirm who you are. To help me understand you, can you tell me your date of birth like this? March 12th, 1980?
March 2nd, 1990.
Thanks for your help, John. Please stay on the line while I take a moment to get your information. I can help you find, reschedule, or cancel an existing appointment. What would you like to do?
I'd like to reschedule my appointment.
Please stay on the line while I take a moment to get your information. I have found 2 appointments for you in the calendar. The first appointment is with Dr. Manning on May 7th at 9 a.m. The second is with Dr. Manning on September 1st at 9 a.m. Which one would you like to reschedule?
The first, please.
Just to confirm, you want to reschedule your appointment with Dr. Manning on May 7th at 9 a.m. Is that right?
Yes, it is.
Please stay on the line while I search for appointment openings. Okay, let's find a different time for you. The next available opening is May 10th at 9 a.m. Would you like to take this appointment?
No, that's not going to work.
Okay then, I also have a couple of other openings I can offer. The first is on May 10th at 1 p.m. The second is on May 11th at 9 a.m. Would you prefer the first or second option?
I'll take the first.
All right. Just to confirm, you would like to book an appointment with Dr. Manning on May 10th at 1 p.m. Is that right?
Yes, it is.
Okay, I have scheduled your appointment with Dr. Manning. Can I help you with any other appointment tasks?
No, thank you.
Thanks for calling and see you on May 10th at 1 o'clock.
All right, so that was Amy. And so in addition, VoCall also includes a dashboard, which shows how calls are being scheduled and where they're being routed. Interestingly, we found that practice managers found this data to be very useful because they were previously unaware of what kind of calls are coming into their practice. And they're able to use this information to make better use of the data to allocate their resources.
Great. Thank you very much, AJ and team. I really appreciate the insight and info. And we are going to jump over to some questions here. And again, if you have any questions and you'd like to ask the team, just feel free to punch that Q&A button at the bottom, type in your question, and we will get to it ASAP. So first question here is how many calls can the system handle at one time? Paul, since you designed it, you want to take that one? You're going to have to take yourself on mute there, Paul.
Sorry. Yeah, so for just a single phone line, VoCall can handle up to 30 simultaneous calls. And so for the larger clinics, if they have a larger volume than that, what we'll do is we'll set up 2 or more phone lines for that practice.
Thanks, Paul. Second question here. You mentioned that Amy plugs into an existing phone tree. Can VoCall work in practices where the phone is answered by a live operator? Paul, since we had you there, do you want to answer that one as well?
Yeah, so the answer is yes. And the way that would work is that the operator would just transfer that phone call to the Amy line. And then Amy would take it from there.
Got it. Yeah, it's a pretty common practice that some practices will answer live and it can handle that quite easily as well. The next question is, do I need specific software installed on my device for VoCall to work?
Yeah, the answer is no, that VoCall is a cloud-based system. And so there is no software that has to be installed in your office. You just enter your Allscripts information into the web portal. And so it's just a cloud connection to your Allscripts application. And it doesn't matter if you have Allscripts actually installed in your practice or in the cloud, it will work with either one.
Excellent. Next question is, what happens if there is a scheduling need that VoCall cannot handle? Excuse me.
Yeah, so we've designed VoCall to be able to manage situations like that because we realize it's not going to be able to handle 100% of the calls. And so in cases where it can't reschedule a patient, the system will automatically transfer the patient to a scheduler to take care of them.
Got it. Next question down here is, how does the phone number you provide work directly with our main number? How does that process work, Paul?
So it will depend on how you have your phone system set up. And it will probably be that you'll work with your phone service provider, but it's basically just inserting that phone number into your phone tree. So for example, if normally you have option 4 is for your scheduling department, then that phone number would be inserted into option 4. So as opposed to actually going to the scheduling department, it would actually go to VoCall and to Amy.
So it's basically program your phone tree to, as the option is selected, it then kicks that out to that number that VoCall is there and
Exactly
connects through. Yeah,
exactly.
Can I add something to that, Bill?
Sure.
Like at our practice, we do have a phone tree and you select option 3 for scheduling, but then we have a separate like selection inside of that says, press 1 if if you have an existing appointment, press 2 if you'll be new to the practice, press 3, so you can customize it where ours doesn't call Amy till you select option 1 underneath option 3. Does that make, so you can break it down as far as you want to like that.
Yeah. And working with your phone tree provider, you guys were able to set that up and make that work that way.
Yes, sir.
Yeah, thanks. Next question says, sounds great. Quick question. Our practice works with a number of non-native English speakers. Can we still use this? It's a good question.
Right now we have English only, but we are working on additional capabilities to add other languages. We've just added some additional capability for the hearing impaired so that the patient can actually adjust the volume to meet their needs. But we're constantly adding new capabilities.
Also, the system does have the ability to handle a number of dialects and accents.
Yeah.
Still in English, but additional accents.
Yep. Does it very well. Thank you, Dr. Geyer. Next question. Does it schedule all types of appointments, including new?
No, currently we are not handling new appointments. We're just handling existing appointments or existing patients, but that is a capability that we will be adding in the future.
Next question here is, many Allscripts clients use generic providers for procedure clinics or specialty clinics. How does the voice tree handle these situations where it's not a doctor, but name, but clinic surgery? Does that make sense, Paul?
So I can tell you what we do in our practice,
Yeah.
because we have a number of those. Yes, it can handle it. If the appointment is scheduled in any appointment type, for example, for me, if I have a clinic appointment, it's going to be under me. If I have a neurophysiology test, it's going to be with a tech, but it's still something associated with me. And then there are some other testing scenarios and therapy protocols. As long as the patient has an existing appointment, it can reschedule the appointment whenever they need it. And they can certainly cancel it or confirm it without any difficulty, but it's just rescheduling inside that same appointment type. And I'll check because Monica knows better than I do that I get that right.
That is correct. Yes, sir.
Excellent. Thanks. Are you able to customize the recording? We are a huge practice with specialty departments who require specific instructions to patients, such as arriving 30 minutes on new patients or to bring certain supplies to a visit.
There is a certain amount of customization that we can provide. I guess one of the important things of what we do is that since we're tied in with Allscripts PM, if you have other components like Freesia, then everything that is changed as far as like appointment reminders and things like that are automatically handled with that.
Okay.
We have we utilize Freesia here. And it does all that. Like if the appointment's changed right now, if Amy changes an appointment right now and the patient's appointment's tomorrow, their reminder is going to have the new date and time immediately literally within seconds of Amy changing it.
Yeah,
but also at setup, you can say that you want a patient to arrive 30 minutes early, bring your prescription bottles with you, bring a prescription list with you. There's a number of things you can do to customize for an individual practice or physician.
Excellent. And Monica, you had mentioned you can actually see when you had told us when Amy's going in and changing appointments, it actually shows and you can actually track it to see it. And then it just gets like anything else, anybody else changing an appointment, it shows and it picks it up in practice management.
Correct. Yes, sir. If the people that are on here, if they actually, utilize PM every day, you can go into any appointment at any time and click on it and see exactly when it was scheduled and the exact user that scheduled it. Same thing with this. It actually shows up as VoCall. So the, user that made the appointment will have the date, the time, and everything that it was made. So literally if Amy reschedules an appointment and then the patient remembers something else, calls back to the clinic and, immediately and says, hey, I just did this and I need to verify something. They get the nurse's line by accident or something, then it's there. They can see it and they can say, oh yeah, she just rescheduled this for you, or oh yeah, she canceled it for you, or whatever. So it's immediate.
Oh, excellent. Thank you. Next question. Can VoCall handle pediatric offices? For example, mom would be calling for an appointment for potentially 2 to 3 siblings. Can VoCall schedule both appointments and have them by together, same day, same provider, same office, etc.? Good question.
Yes, VoCall can handle that. When the person calls in, they just enter their name and their date of birth. And I'm sorry, the phone number and the date of birth, and then that will associate the call with the appointment. And then it doesn't matter if they have, 4 or 5 people, children within the clinic, VoCall will automatically find the appropriate records.
Excellent. Next question. How does it work with different scheduling locations for a provider that only works certain days each month at that location?
As long as it's all the different locations are tied in with one Allscripts practice management, it doesn't matter, because Allscripts, Amy is pulling the information from Allscripts PM. So as long as the provider has their information in Allscripts PM, Amy will be able to find that and set the appropriate dates.
We have multiple locations here. And so if you have multiple locations, I think it has to be in PM for scheduling purposes and because PM is also used for billing purposes. So it's in there and Amy's going to pull from all those locations as long as you're utilizing PM for all those locations.
Excellent. Is there an option for patient to choose a live scheduler?
We do have a capability for a patient to transfer to a live scheduler, but we don't like to really advertise that because we want the patients to use Amy and free up the schedulers as much as they can. But yes, if they can, if they need immediate assistance or have a complex scheduling problem, they can transfer to a live scheduler.
And there's some, and Paul, you and I have talked about this, and Dr. Geyer, Monica, you might be able to chime in too because you've had some experience, but there's some intelligence built in where if somebody is really struggling, it does, kick them out to a live scheduler to make it so they don't get overly frustrated. Correct?
Right, exactly. Yeah, and so, we monitor how many times they ask a question or, if it doesn't recognize what they're saying. And so you're right, there's some intelligence behind that. And so if there's trouble in meeting what the patient wants to do, it's automatically kicked out to the scheduler.
There's lots of different mechanisms that kicks it out to a scheduler, whether Amy actually picks up the patient struggling, it'll do it without them even asking for it. There's keywords the patients say that will transfer them out to somebody to help them. when we transfer at our practice, when Amy transfers somebody out, it actually, we have it where the patient can select an option for the specific doctor so that it goes straight to that doctor's scheduler. Now, that's not necessarily going to be needed in all practices, but that can be even specialized when Amy transfers out. Where do you want that to transfer to? And does the patient need to have options of where that phone call goes? So you can specialize that also.
Got it. Thank you. Next question. This one may require Paul for us to reach back out, but it's does VoCall arrange only OV, or is it also compatible to arranging ancillary testing as well? What happens if a patient will need to arrange both an OV and an appointment for a test that is ordered via a provider?
Dr. Gower, can you answer that?
Well, when I order a test that's done inside our scheduling system, then it can access any of that. If I order a test that's, say, done by the cardiologist down the hall, it's not going to know to make that schedule. But if it's an appointment that I've set up, they're seeing me and they're having a test done in my office, either by me or by another provider in my group. It doesn't care. It will know those appointments are there and can be rescheduled. But if it's an outside test that just happens to be the same day that I've made, it won't know that.
Next question. Can it handle when multiple appointments that are scheduled back to back? Example, labs, PCP, PT, or other specialists?
Yeah, if those are, I guess, considered as multiple appointments, VoCall will just pull that information and treat those as different appointments. And so, and we'll ask the patient which one they want to reschedule or confirm.
Please clarify, does VoCall Amy also provide reminder calls, or does office staff still have still contact scheduled patients to complete this task?
No, VoCall does not send out any kind of reminders. We're simply a front end to let the patient reschedule or confirm or cancel appointments. But if you're tied in with PM and you also have an application like Freesia, then Freesia will handle those reminders for you if you have that set up.
Right. It'll integrate to anything that's already existing and set up.
Right.
Follow My Health. Monica, I believe you guys use Follow My Health?
Yes, sir, we do.
Yeah. And it works and it integrates with Follow My Health completely.
Yes, sir.
Cool. How does the system handle different appointment types and different amounts of time for each one? Well care for a 12-year-old is 30 minutes. Well care for a 12-month-old is 20 minutes. Office visit for medication, 30 minutes. Rash is 10 minutes.
I can answer that one.
That'd be great.
When you set your templates up or your scheduling protocols up in PM, if you've made that well child visit in PM as 30 minutes, when you set these, like when you making that doctor's schedule or making that particular scheduled time, you already have to put a time increment in it in PM to create that appointment type. So that's already there. So it already has those specifications tied to that appointment when Amy takes it over and reschedules it. So it will do the exact same thing, and it will only give out the time slots that are available for that appointment type. Each slot is designated what appointment types can be put there. So it won't give you anything that doesn't meet all the parameters of that appointment type you've already established.
Excellent. What about rescheduling procedures that require certain days and times as well as medication in certain directions? Can we program her to transfer when it's a procedure appointment? Similar to, I think, a previous question.
For us, we had certain appointment types. We have a huge number of appointment types here in the PM. We had certain appointment types that we did not want her to handle because of them being so specific. And when you set your practice up, you're able to select the appointment types that you want Amy to handle. And if you don't want her to handle a certain one, you just don't choose that appointment type.
A specific one for us is one of my partners does a great deal of Botox, and for neurological conditions especially, there's a very set time increment for it, and we didn't want the patient to be able to reschedule and have it become an uncovered service, or, you know, from a pure clinical care perspective, make their appointment either too close so that they're getting Botox injections too frequently, or too far apart so that they were having their spasticity return. So that's one of the ones that we chose to block so that the patient couldn't move their appointment too far out of the clinical guideline.
Excellent. We have several appointment types built into PM, such as diabetic consults, diabetic office visits, regular consults, or OV. How does the system differentiate between the two to ensure the patient is scheduled correctly? Does the patient need to specify the significance of the visit they are wanting to schedule? This will require a lot of educating on patients to use correct verbiage when arranging a specific call. I think you guys have answered that. It's for rescheduling, and you guys can, Paul, you can correct me if I'm wrong, but once the schedule is made, and if a client or patient calls to reschedule, they will reschedule in the same class of appointment.
Right, exactly. And then when Amy is telling the patient what appointments they have, it will tell them that you have this appointment on May 17th for this purpose. And then so that way the patient knows what that appointment is if they have multiple appointments set up.
Question. Patients typically have multiple phone numbers in their file. Will we need to identify a preferred number, or can a patient leave any one of their phone numbers on file to Amy?
Yeah, it doesn't matter. As long as they have a number on file, it doesn't matter if it's 2 numbers or 5 numbers. As long as those numbers are in PM, Amy can confirm their identity.
Okay. Since we have a sleep medicine clinic, how do we handle 31 to 90-day follow-ups for CPAP follow-up based on Medicare rules? I see Dr. Geyer smiling.
I'm smiling. My scheduling guru, Monica, is changing to a different device. She would have probably answered this question even better than I will, but so it's a 2-part answer. One is we have a set appointment type for CPAP follow-up. The second is that we are also tying into another system that we've developed to help us maintain the correct window for the appointment. So it's a combination of, we have an appointment type, it's set for the right number of days, and we've got another way that we go about making sure that patients don't call and reschedule outside their window. So it's actually a pretty complex question. It sounds easy. It's like a lot of things for every specialty.
Right.
When you're not in the specialty, it sounds easy, and then you get in there and
Right.
very complex. But it can handle some aspects of it on its own, but there are components to the CPAP follow-up we had to do separately.
Right. Anything you want to add to that, Paul?
No, I think Dr. Geyer answered that very well.
Yeah.
Covered it.
Got it. And this was a follow-up question. What if the patient is requesting a new app appointment? I'm sorry, my question was pertaining to new appointments, and I think I can handle new appointments are not handled by Amy and VoCall.
Well, except it doesn't actually schedule a new, but if somebody has a new appointment, a new patient slot,
Correct.
and they need to reschedule, cancel, or confirm that new appointment, it can do so. It just cannot make the initial appointment. And there's a lot of reasons that we in our practice would not have wanted that. There's making sure it's for the right provider in the clinic, making sure it's the right amount of time for the right problem, and really making sure they're referring them to the right specialty.
Right place, yeah. Please confirm costs of VoCall. Understood, $249 per month per provider. That is correct. That is our provider. Got it. Thanks for the clarity. Disha was thanking you guys for the clarity. And I think we've got a few over there in chat. Let me see what we have. I wasn't ignoring you. We answered that one. Can it handle when multiple appointments are scheduled back to back? Yeah, we answered that one. Can you talk about patient matching? I'm not sure quite what that means, but it might be something we can handle offline. Is there anything you want to add to that, Paul, on how you match patients, probably with who they are, identify them?
Oh, yes, sure. Yes. So as far as confirming a patient when they call in, so they have to enter their phone number and then enter their date of birth. And so as long as they have their phone number or phone numbers in PM, Amy will be able to find them and identify them.
Is the technology built in-house or use a third-party API for HIPAA purposes?
VoCall is totally HIPAA compliant.
And it does exist in the cloud, so it's not on site there for your practice, but you do not have to worry about the security, and it is HIPAA compliant. And we answered that one as well. One more question. Patient matching would not apply unless a new patient wasn't being added is the comment here. So, okay. Looks like we have one more here. We are an ACO and heavily coordinate our patients' care between providers and services in our buildings. So the question is, in a back-to-back, will it reschedule them as a group back-to-back?
And for us, if the appointment is a linked appointment, then it understands that. If you just have appointments that have been completely free-form scheduled and just placed in the schedule, then it won't, at least for us, know that those are linked. But we have certain appointment types that are linked directly and inside the schedule building component of the system of all scripts.
Excellent. Oh, I was just going to say, I think that's it, but we had one more. What about patients who are scheduled, then provider scheduled is closed? Does Amy handle those appointments who are bumped? Did that make sense, Paul?
Yeah, so currently we do not handle that, but that's one of the features that we are working on. So it would depend, just a scheduler would have to call that patient to rearrange or reschedule their appointment.
Good. Excellent. All right. I think we've gone through the questions. I thank everyone on the panel. You guys did a fantastic job. We appreciate everyone joining. If we can be of any additional help, feel free to jump to the website at www.getvocall.com. There you'll see a whole bunch of information, and you can also on your screen there email us at any time. We appreciate it, and have a good day.